Welcome back and thanks for staying with us. Spokesperson for the Health Department, Dr. Lwazi Manzi, has been appointed as Head of Secretariat of the AU Commission on COVID-19. The Presidency a few days ago announced the establishment of the African Union Commission on COVID-19. The Commission will work within the established African Continental Strategy structures. Now, for more on this, we're joined by SABC News International Editor Sophie Mokoena. Sophie, thank you so much for your time. Perhaps take us through this development. Firstly, from just the Presidency announcing that this AU Commission on COVID-19 is going to be established. And secondly, the appointment of Dr. Manzi.
Well, it started in February 6 early this year during the Assembly of Heads of State and Government of the AU, the annual meeting early in the year, where President Ramaphosa handed over the responsibility of chairing the AU to the DRC. Therefore, there was a feeling from the members of the Assembly, the heads of state and government, that President Ramaphosa must continue with the work he had started of coming up with a strategy to combat COVID-19 on the continent. Remember, in 2020, he was the chair of the AU, and therefore, when we had that outbreak of COVID-19, he had to come up with a strategy in terms of how the continent can deal with this pandemic. And he had done a lot of work, had appointed people as envoys to look at how countries, the rich ones, they can collaborate with Africa in terms of access to PPE when it started, and later establishing a facility that deals with procurement of vaccines. And you are aware that one of the very famous businessmen on the continent, Stras Masiwa, was appointed to work on African Joint Strategy and also African Medical Supply Platform, and later AVAT, that is the African Vaccine Acquisition Task Team. So based on that kind of work he had done, they requested him to continue with that work. Now, he realized that he needs a support system to do this work, and therefore it was proposed that there should be a commission, a fully fledged commission that is assisting the president to do this work. So the president will chair this commission, and then the deputy chair will be the Africa CDC director, John Kenkasong. And from there, he had to establish a secretariat. Now, this secretariat will be led by Dr. Lwazi Manzi as the secretary of this commission, and therefore dealing with the work of this commission on daily basis, based on her experience in terms of health issues, but also in terms of her involvement during the process of repatriation of South Africans from Wuhan, the launch of the campaign to fight COVID-19, vaccine campaign and all of that. I think the president realized that she is better placed to be in the secretariat and to lead on daily basis what the commission is supposed to do.
Sophie, interestingly, you mentioned businessman Stras Masiwa earlier. Now, I know in an interview that he had done during the pandemic, he was very scathing in terms of what is now termed, the apartheid kind of approach in distributions of vaccine, even before the COVAX was formulated. Talk to me about just the level of comfort the African Union, particularly this continent, has on the process of how vaccines have been distributed so far globally.
Well, of course, if you look at the current problem of vaccine apartheid or vaccine nationalism, whether you have money, whether you have resources, it will be a problem for a country to buy vaccines, or procurement of vaccines will be a challenge, because you have these rich industrialized countries, the G7 in particular, who have invested a lot of money in the research of these vaccines and also have paid in advance in terms of buying doses. And therefore, when you come as a country, you will not be able to match the United States of America, when the dollars they have to buy. You will not be able to match Germany with those euros, nor the pounds from United Kingdom. And therefore, when Africa is working together and the procurement is centralized, is done for all member countries, you're now talking about procurement for a population of 1.2 billion. And therefore, you can see now it is at least a big deal for any pharmaceutical company. And therefore, it is for that reason President Ramaphosa realized that he needed to appoint these envoys and Strive Masiwa to lead this the campaign, African Medical Supply Platform and AVAT, African Vaccine Acquisition Task Team, so that we can get the PPEs as the continent and the vaccines as the continent. We were told last week, Thursday, by the CDC director, Dr. John Gengasong, saying that they are already working hard to procure vaccines, even though it is very difficult. Therefore, I think it was a wise move. I think the only problem is that Africa was looking at AVAT, but also they were looking at COVAX, that is the WHO facility. And therefore, the WHO facility, there were challenges. And now they are trying to speed up the process of procurement through AVAT, or African Vaccine Acquisition Task Team work. So it is hoped that very soon, in fact, this week, Thursday, during the media briefing of the Africa CDC, the director will give us a feedback, because you'd recall last week he said he was dashing to a meeting of heads of state and government where he's going to give a report in terms of challenges and, successes. And I think from that meeting, he will communicate this week decisions taken and give us information in terms of where we are as a continent in terms of procurement of vaccines through African Vaccine Acquisition Task Team work.
Sophie, thank you so much for your time this afternoon. We really appreciate that analysis. Our international editor, Sophie Mokoena, just giving us some analysis on the appointment of spokesperson for the Health Department, Dr. Lwazi Manzi, being appointed as the head of the Secretariat of the AU Commission on COVID-19.